Hi, and welcome to another vlog on my journey of recovery from TLIF surgery, which happened 10 days ago today. So I thought, given the 3 days or so passed since I last posted, it's probably a good time for me to give a bit of an update on what's been happening since we last spoke. So in terms of routine, much the same in terms of, doing the rehab exercises, walking, resting, and then repeating all of the above over the course of the day. What has changed is I've had a couple of outings, so to speak, which I hadn't done prior to my last update. So the first was on Wednesday, which was a couple of days ago, which was my youngest son's 4th birthday. So I joined the family, some of his friends and their parents at a restaurant about a 5-minute drive away from where we live. And then today, which is Friday, I also had a friend of mine come and visit to come and check on how I'm doing. So that's been very nice. So some observations from these visits. What I've learned is that it's comfortable to either sit, stand or walk at any given point in time. However, not for too much time continuously. So for example, what I found whilst out for my son's birthday party is that I could sit quite comfortably, but as soon as I got to the kind of 15-20 minute mark, it started getting a bit uncomfortable, and then I needed to get up and stand for a bit and maybe even walk around for a bit just to make sure that things didn't get too sore and achy. So that was the one observation. The other observation is more of a general observation rather than as it pertains to the kind of outings, is that the rate of improvement or the rate of recovery seems to have slowed down a little bit versus what I saw before. And let me explain what I mean by that. So the change from being in loads of pain before the operation, then having the surgery, waking up in bed, in high care with a morphine pump in your hand, and not being able to do anything for yourself, to 2 days later walking out of hospital, to 3 or 4 days later being able to do most things for yourself, is actually quite a rapid rate of change. As at the last time I posted, was feeling very, very positive about where I was. But what I am noticing now is that rate of change has slowed down. So even though I do still feel a little bit stronger, a little bit better every day, it's not quite as rapid a change, which I guess is fine. It's just something that's going to require a bit more patience for the next 2.5 months or so, until I get to that 3-month mark, after which I've been told I'll be able to do a lot more things, and certainly most of the things that I was able to do prior to the surgery. But I can see that becoming a little bit frustrating. I did mention as well that I did experience that when I had my ACL surgery 7 years ago, where it does take time to get through that, and it does require a bit of mental resilience, so to speak. But other than that, things have been going well. I'm still very happy with where I am. Just a little bit concerned about, if I'm this uncomfortable sitting down for long periods of time, whether I will be able to return to work next week as required, or whether I might need to take a bit more time to work from home, where I can just be a little bit more flexible about whether I'm standing, sitting, or lying down. But we have the weekend to kind of get through, and then we can make that call, I guess, early next week. The other little niggles I picked up on, the first being just in general achiness from trying to push a little bit on the rehab exercises, so doing more reps of the rehab exercises and going a bit further in terms of walking and so on. So today, for example, I've walked almost 6,000 steps, so a bit of a step up, not a huge step up, but a bit of a step up nonetheless. Is you do get a bit achy every time you push, and then you have to kind of cut back a bit the next day just to allow the body to recover and catch up, and then you kind of start building again. So that was one observation. The second one is, I think I mentioned during my introduction that I had quite severe nerve pain prior to the surgery. And it has a very specific name. It's called radicular pain. So when the nerve root gets compressed, and the kind of pain that results. And I mentioned that post the surgery that kind of resolved, and I certainly feel a lot better right now. What I still do have, however, is numbness kind of on the outside of my left foot and also in my kind of 2 outside toes, which is a little bit concerning. So I've done a bit of research around how long it takes for the nerve to heal after being compressed pre-surgery, and it does sound like it's fairly normal. So it can take weeks to months for that to actually settle down and heal. So it is something that I'm keeping an eye on, and I will chat to my doctor about when I next see him. Speaking of which, Monday is a big day. So Monday is 3 days from today, because that's when I have my appointment with the surgeon to just have a general check-in, remove the staples from my wound, and also then have a catch-up with the physiotherapist who was helping me in hospital. So I'm hoping as part of that conversation with the physiotherapist that I can maybe get a few more exercises I can do without putting the recovery at risk, so to speak. Because the ones I've got right now, as I mentioned previously, are fairly basic, a little bit boring to be honest. So I'm hoping for a little bit more just to be able to help kick on with the recovery. So by the time I do my next update, I'll have feedback from those discussions with the physio and with the surgeon, and I look forward to sharing more then. Thanks.